Hey, what's up, my health enthusiast? Dr. LeGrand here for another video, and today we are going to talk about neurofeedback, what it is, how it can help with your health, right after this intro. So you're probably wondering, what is this weird device that's on my forehead? So if you're not familiar, what is neurofeedback? Today in this video I'm going to talk about neurofeedback, how it can be beneficial for a lot of mental health issues, as well as where you can get it done, as well as with the research behind it that backs up a lot of this great benefit of doing neurofeedback. So this device right here, so neurofeedback, what it is, if you're not familiar what biofeedback is, since it is like biofeedback except for the brain. So biofeedback is where you can actually connect many things to your body, such as checking for your heart rate, respiratory rate. You can even hook up electrodes to check up for muscle tension, as well as like sweat. And usually it's hooked up to a monitor where you can kind of see how frequent your heart rate is, your respiratory rate, to see if there's any infrequencies going on. Especially if you're in like a counseling session, you can kind of see this. This is why it's called biofeedback. Whereas neurofeedback is like biofeedback for the brain. It actually measures your brain waves. So this very simple device that I have here is a headband that you can actually use at home. Whereas most biofeedback or neurofeedback clinics, usually you have to go into a clinic where either a clinician or a psychologist or a counselor will use this type of equipment to help their patients, to help with either stress, anxiety, depression, attention, stuff like that, to be able to use that, and you have to go in frequently, and that could be very costly. But with this, the technology has really advanced. This headband, it's a Muse headband. It's called Muse. You can get it on Amazon or anywhere else. And what's great about this is not only is it reading your brainwaves, but it gives you feedback as far as how things are going on within your brain. So how it works, if you look at brainwaves, we have different brainwave frequencies. I'm not going to go into too much detail about the different brainwave frequencies because you have things such as delta, theta, beta, alpha, different brainwaves that we measure, especially when you're doing a sleep study. They'll look at these different types of brain activity. But when we're very stressed out, we'll have higher brain activity versus, if we're a more depressed state or more daydreamy. For kids who tend to have attention issues, those can be infrequent going on there. So what neurofeedback does, essentially, it's exercising parts of the brain that need to be exercised to improve, just like we need to exercise our muscles, right? So this gives it a chance to be able to look at your brain activity, see where there is deficiency or needs improvement to be able to exercise those aspects. And so when you have this device, as it's measuring your brain waves and the clinicians kind of see the brain activity that's going on within your brain, it's usually hooked up to another monitor where you can see those brain waves. And then the person, the patient, is usually looking at either tablets or a different computer monitor that has certain games, or it might be a video, or it might be a sound feedback. So what that's doing is, for example, if you had attention issues, so a lot of times you'll have lower brain activity and you want to be more and more the focused mind state. And it will reward you as you're doing this software. So let's say it's like a racing game and you're just watching the computer screen and your brain is doing all the work, and it'll reward you when you're in a more focused mind state. So you might win in the racing cycle. Versus if you're distracted and your mind is wandering, then it doesn't reward you, it inhibits it. So you'll lose in the game. So the brain learns over time to be able to know what to make adjustments to be able to improve that part of the brain that it's lacking. So this is why it's so beneficial with this, and so phenomenal that technology has been able to improve this far that people can actually take these devices at home, at the comfort of their home, while their clinician is actually monitoring things that are going on in their brain. So you might be asking, okay, Dr. Grant, that's nice and fine and dandy, but what can it treat? What can it be used for? Well, it could treat for several things. So the first initial, when neurofeedback was first introduced, it was for treating for ADHD. So for attention or hyperactivity, it'll help improve those aspects. And there's plenty of research out there that has shown that not only does the symptoms for attention and hyperactivity improve just as well as the medications, except without the side effects. So that's really phenomenal, especially for parents who deal with kids that do have ADHD and want different alternative avenues to be able to help their kids as far as, getting better attention in school and improving in school. Well, this is definitely one way of doing it, neurofeedback. And now you don't have to go to, per se, a neurofeedback clinic that you have to go in weekly or a couple times a week because that could get expensive. This is something you could take at home and use. Other things that neurofeedback can help is depression and anxiety, because again, it's looking at different brain activity. So for depression, it'll probably be hitting highs and lows. Usually a lot of people with depression will have a combo of anxiety and depression. So focusing on those aspects to help your brain focus to be a more focused, calm, relaxed state. The other thing that it also can help is sleep. So if they have any sleep issues, a lot of times people will have high brain activity and can't fall asleep, or they can't stay asleep because their brain is just racing like crazy. This can help bring you down to a more relaxed state. Exercise part of those parts of the brain to be able to improve that. Now, as far as the research, what I just mentioned as far as depression, anxiety, ADHD, and sleep issues, there's plenty of research on there as far as what has shown to be just as beneficial as a lot of the medications. Now, when it comes to sleep issues such as insomnia, a lot of the sleep medications aren't really helpful because they aren't long lasting. They might be something good for maybe for a couple nights, for a week, but it really isn't going to help treat the problem. A lot of times it has to do with a lot of stress. So we have to use things such as neurofeedback or counseling to be able to bring down the stress so that your sleep cycle can be improved. Now, the other question you might be asking, okay, where can I get this done? Now, a lot of psychologists, you'll have to find a psychologist or a clinical psychologist or even some other clinicians that use neurofeedback to help with their treatment. So what I would suggest wherever you're at is just to type in, neurofeedback clinic and see if they do remote neurofeedback. That's one thing that you should ask. It's something that we do at our clinic. So if you're in Washington, that's something that we do provide at our clinic. So if you're interested if you're in the area, we do provide neurofeedback. But just check, just do a simple Google search, neurofeedback, and whenever you find a clinic, ask if they do remote neurofeedback, because those costs can be brought down significantly because you don't have to go into the clinic and use the clinician's time every time you're doing a session. Because the most important thing when it comes to neurofeedback or doing biofeedback is practicing. And this, by doing remote neurofeedback, gives you that opportunity to practice several times a week and consistently doing it versus, have to worry about the expenses when it comes to always having to do a session with a clinician. So just summarize, if you guys are interested in me talking more about neurofeedback, this is just something new because it's something I'm doing more in my clinic and wanted to talk to you guys about it and just see if you guys were interested. Leave that in the comment section below. I could talk about how more neurofeedback can help ADHD, insomnia, depression, sleep issues, stuff like that. Go ahead, leave that in the comment section below if you want me to talk more about videos about this. If not, just go ahead. If you have any more questions about this video, if you're new here, we do talk about a lot of different health topics, a lot of different alternative medicine. We do talk a lot about fasting, as well as just other alternative health topics. So if you're new here, go ahead and hit that subscribe button right over here. Also, check out some of these playlists that I'll leave right here that you can check out. Until next time, this is Dr. LeGrand signing out. Thanks. Bye.